Welcome to Study Session 6. Diabetes mellitus. Introduction. A diabetes mellitus is a chronic disorder associated with carbohydrate, fat and protein disorder. It is multi-system disorder and it predisposes the sufferer to other conditions, cardiovascular disease, renal, nervous and eye complications. There is an increasing global prevalence, 7%, about 20.8 million Americans. Learning outcomes. At the end of the study, you should be able to describe diabetes mellitus, describe the structure of the pancreas, discuss the global estimate of diabetes mellitus, explain the types of diabetes mellitus and the pathophysiology. Global estimate. For all ages in 2000, 2.8%, 171 million. Projected estimate in 2013, 4.4%, 366 million. Urban population in developing countries is projected to double between 2000 and 2030. The figures indicate diabetes epidemic will continue even if levels of obesity remain constant. Structure of the pancreas. The pancreas is a long, slender gland which lies behind the stomach. It is located in front of the first and second lumbar vertebra. It consists of 3 parts, head, body, and tail, and contains lobes and lobules. The pancreatic duct extends along the gland and enters the duodenum through the common bile duct. Consists of both exocrine and endocrine functions. A. Endocrine functions occur in the islets of Langerhans. B. Beta cell. Islets of Langerhans secrete insulin. C. Alpha cells secrete glucagon. D. Delta cells secrete somatostatin. E. F cells secrete pancreatic polypeptide. Types of diabetes mellitus. The following are the types of DM. Type 1, insulin-dependent DM. Type 2, non-insulin-dependent diabetes. Pathophysiology. Type 1, insulin-dependent diabetes. Autoimmune response. 80 to 90% of normal beta cell is destroyed by autoantibodies of islet cell. The body's own T cells attack and destroy pancreatic beta cells. Non-insulin production leads to hyperglycemia. Blood glucose concentration exceeds renal threshold. Excess glucose in the urine results in osmotic diuresis and excessive fluid loss. Breakdown of body fat and proteins resulting in ketone bodies. 3 classical signs: polydipsia, polyuria, and polyphagia. Diabetes mellitus. Risk factors: obesity, heredity, metabolic syndrome, cluster of abnormalities that act synergistically to increase the risk of CVD. Diagnostic tests: plasma glucose level, fasting blood glucose, glycosylated hemoglobin. Nursing management, functional health patterns, health perception, health management pattern. Symptoms that preceded diagnosis: polyuria, polydipsia, polyphagia, weight loss. Family history of DM includes drugs, alcohol. Nutritional metabolic pattern. Inquire about normal diet pattern, 72-hour diet recall. Weight loss, food taboo and allergies. Weight loss and gain, excessive thirst, polyphagia. Sexuality reproductive pattern, vulvovaginitis parity. Elimination pattern, polyuria, frequency and urgency. Signs of diabetic ketoacidosis, skin turgor. Activity exercise pattern, exercise tolerance. ability to perform self-care activities, cognitive perceptual pattern, visual deficits, motor and coordination, pains, neurological deficits, paraesthesia, numbness, aphasia. Nursing diagnosis: risk for fluid volume deficit related to polyuria and dehydration, altered nutrition less than body requirement related to imbalance of insulin, food and physical activity, knowledge deficit related to diabetic information, NOC, maintaining fluid and electrolytes, improving nutritional intake, reducing anxiety, improving self-care, monitoring and managing potential complications, promoting home and continuing care, compliance to drug regimen. Summary to study sessions 4, 5, and 6. This study has attempted to examine the following: hepatitis B, cholestasis, diabetes mellitus. Diabetes mellitus is a chronic disorder associated with CHO, fat and protein disorder, a multisystem disorder. It predisposes the sufferer to other conditions, CVDs, renal, nervous, and eye complications. There is an increasing global prevalence, 7%, 20.8 million Americans. Cholestasis is a disease affecting the gallbladder. Most cases are caused by gallstones. Normally, if one is diagnosed with cholestasis, the person is admitted to the hospital for treatment with painkillers, fluids, and sometimes antibiotics directly into the vein. Hepatitis is an inflammation of the liver parenchyma, which constitutes a major public health problem. Health education plays a major role in its prevention, with nurses at the forefront. All healthcare providers must be conscious to observe standard precautions when providing care to prevent transmission, contacting hepatitis viruses from their patients. End of study session 6. Thanks for listening.